Levothyroxine, also known as Synthroid, Levo-T, Thyrotabs, Levothyroid, and Levoloxo. The classifications are therapeutic is for hormones and pharmacological is thyroid preparation. The indications for this medication are thyroid supplementation in hypothyroidism, treatment or suppression of euthyroid goiters, and adjunctive treatment for thyrotropin-dependent thyroid cancer. The mechanism of action and drug effects for levothyroxine are a synthetic form of thyroxine, replacement of or supplementation to endogenous thyroid hormones. Principal effect is increasing metabolic rate of body tissues, promoting gluconeogenesis, increase in utilization and mobilization of glycogen stores, stimulate protein synthesis, promote cell growth and differentiation, and aid in the development of the brain and CNS. The therapeutic effects are replacement in hypothyroidism to restore normal hormonal balance and suppression of thyroid cancer. The absorption of levothyroxine is variably absorbed from the GI tract. It is distributed into most body tissues. Thyroid hormones do not readily cross the placenta. Minimal amounts enter the breast milk. Metabolism and excretion is done by the liver and other tissues to activate T3. Thyroid hormone undergoes enteric hepatic recirculation and is excreted in the feces via the bile. The excretion half-life is 6 to 7 days. The duration of action is 24 hours, and the onset of action is 3 to 5 days.
The contraindications for levothyroxine are hypersensitivity, recent MI, and hyperthyroidism. You are to use this medication cautiously in cardiovascular disease, severe renal insufficiency, and uncorrected adrenocortical disorders. Pediatric patients should be monitored for cardiac overload, arrhythmias, and aspiration during the first 2 weeks of therapy, and geriatric patients could be extremely sensitive to thyroid hormones, so the initial dose should be decreased. The possible adverse effects are usually only seen when excessive doses cause iatrogenic hyperthyroidism. Those effects are headache, insomnia, irritability, angina pectoris, arrhythmias, tachycardia, sweating, hyperthyroidism, menstrual irregularities, abdominal cramps, diarrhea, vomiting, heat intolerance, weight loss, accelerated bone maturation in children.
The drug-to-drug interactions are cholestyramine, cholesevelam, cholestipol, sodium polystyrene, sulfonate, and sevelamer. May bind to and decrease absorption of orally administered levothyroxine. Administer levothyroxine 4 hours prior to these medications. Absorption may be decreased by orlistat, protein pump inhibitors, sulcrophate, antacids, and simethicone. May increase the effects of warfarin. It may also increase requirements for insulin or oral hypoglycemic agents in diabetics. Concurrent estrogen therapy may increase thyroid replacement requirements and increase the cardiovascular effects with adrenergics. The drug-to-food interactions are food or supplements containing calcium, iron, magnesium, or zinc may bind to levothyroxine and prevent complete absorption.
The nursing assessment is to assess the apical pulse and BP prior to and periodically during therapy. Assess for tachyarrhythmias and chest pain. In children, monitor height, weight, and psychomotor development. Monitor blood and urine glucose in diabetic patients. Insulin or hypoglycemic dose may need to be increased. Lab test considerations should be monitoring thyroid function studies prior to and during therapy. Monitor thyroid-stimulating hormone serum levels in adults 8 to 12 weeks after changing from one brand to another.
Toxicity and overdose. Overdose is manifested as hyperthyroidism. Usual treatment is to withhold the dose for 2 to 6 days, then resume at a lower dose. Active overdose is treated by induction of emesis or gastric lavage, followed by activated
The patient teaching. Instruct the patient to take the medication as directed at the same time each day. Take missed doses as soon as remembered unless it's almost time for the next dose. If more than 2 to 3 doses are missed, notify a healthcare professional. Do not discontinue without consulting a healthcare professional. Explain to the patient that medication does not cure hypothyroidism. It provides a thyroid hormone supplement. Therapy is lifelong. Advise the patient to notify a healthcare professional if headache, nervousness, diarrhea, excessive sweating, heat intolerance, chest pain, increased pulse rate, palpitations, weight loss greater than 2 pounds a week, or any unusual symptoms occur. Caution the patient to avoid taking other medications concurrently with thyroid preparations unless instructed by a healthcare professional. Advise the patient to take 4 hours apart from antacids, iron, and calcium supplements.
These were our references.